If you've just injured your knee or you have knee pain from playing pickleball and things are not feeling too good, this video is for you. Hey guys, Phil here, Doctor of Physical Therapy. I want to bring you guys today something that's more actionable and then that will directly impact the way that you feel on the courts. So what we'll do today is we'll give you 3 exercises that would really help if you're dealing with any kind of knee pain. So these 3 exercises are more specifically for those over the age of 40 because these are a great entryway to building strength in the knee. You might be wondering, if our knee hurts, why do we want to do more strengthening? That's a great question. Because honestly, that's one of the most important things that we can do, and it's one of the only things that you can do. Especially with something like playing pickleball, it is an accumulative stress oftentimes. After a long day of playing or just standing and being on the courts, your knees can start to act up. This is often caused by the accumulative stress of pivoting, moving around, jumping, stepping back, sprinting, squatting, all the different kinds of movements in pickleball. Basically, the reason why we need to strengthen is we want to build up more capacity so that you can handle all these demands of pickleball. You might wonder, why can't we just play more pickleball to get better and get stronger at pickleball? That is a good question, and that is partially true. The more pickleball you play, the better you will get at pickleball. But you might aggravate your knees or your joints, especially if you have any underlying issues from the past. This is especially important as we age because we want to be healthier in order to have a longer career of playing, of staying active and healthy. We want to be nice to our joints. And how do we be nice to the joints? Guess what? It's strengthening. We don't want you to be down this vicious cycle of you play, you get hurt, you ice, take some pain meds, wait a couple days, and you play again. And then the same thing happens again. That is not good, right? We always want to find the right balance of playing, of strengthening for you so that you can have a long career. Number 1, we're gonna do what's called a straight leg raise. So this is a very simple exercise, but it's also very effective at loading the quads. This is often one of the first exercises that I give clients, especially if their knees are already bothering them. Because you're in a lying down position, you're not putting any weight on your knee. So it's a great way to strengthen your quad and your hip without straining and putting too much more stress on the knee. This is a classic exercise in physical therapy, and we often give these out to patients after knee surgery or anything like that. So how you do this, you lie down on your back, you're going to bend one knee and keep your other knee straight. So we're gonna target the knee that is straight. And then all you're gonna do is you're gonna kick your leg up while keeping that knee straight, up and down. That's it, nice and slow. And this is something that we can work on higher rep ranges. You can do something like 20 to even 30 repetitions, nice and slow, 2 seconds up, 2 seconds down. The goal is to feel something in the front of the hip and also in the thigh. If you have ankle weights, or something like that, you could also put an ankle weight on your ankle, which will make it harder. But if you don't, you can just do more repetitions. So if your knee is bothering you, this is one of the first go-to things that you could do to strengthen the quad, which will support the knee a little bit better and hopefully make your knee stronger and help get you better. Super simple. I recommend doing 3 sets of repetitions from 20 to 50. Or if something feels uncomfortable when you're doing this, couple of things that you can do to modify the straight leg raise as well is to decrease your range of motion, so just lifting a little bit, or you can decrease the reps, so you don't have to do reps of 20, just do reps of 10. That's totally fine. And next, exercise number 2, the wall sit. This is another classic exercise that we like to give out to patients because it's simple to do and you can do it anywhere. All you need is a wall. So all you're gonna do is you're gonna find a wall, you're gonna lean against the wall, walk your legs out, slide your back down the wall until your knees are about at a 90-degree angle. And you want your legs to be about shoulder width apart. And all you're gonna do is you're gonna hold this position for 30 to 60 seconds or so. So this is also what is called an isometric exercise. Isometric exercise just means that we are not moving when you're doing this exercise. Isometric exercises are really well tolerated, especially after an injury, because you're not moving through the range of motion, you're not doing anything too crazy. You're just specifically targeting your quads and getting them stronger. So I also want you to do these for around 3 sets of 30 to 60 seconds. If getting into this position is uncomfortable or hard, there are a couple things that you can do to make it feel better. First is reducing the range of motion. So when you are sliding down, you don't have to get all the way to that 90-degree position. You can do maybe 60 or 70. So basically you're sliding less down, you're staying more upright. Number two, you can decrease the length at which you're holding this wall sit. So instead of holding it for like 40 to 60 seconds, you can hold it for 20 to 30 seconds, right? So the goal is we want to strengthen your legs without aggravating things. Last but not least, number three, one of the most important exercises that we give out to any kind of knee rehab patient is the hip abduction. So what this means is strengthening your outer lateral glute. This muscle is also called a gluteus medius, if you want to be technical. What you're going to do is you're going to find a resistance band, right? So these are super easy to find at the gym, or you can get them on Amazon for pretty cheap. So resistant band, you want to put it around your knees. I highly recommend getting one because it's really good to have the right tools for these exercises, and they're pretty cheap. You want the resistance to be medium to heavy. You're going to stand on one leg, soften that knee, so with a slight knee bend, and you're going to kick your other leg out diagonally back while keeping that leg straight. So when you're doing this, you should feel your hips working on both sides. So you should feel it working on the left side and the right side, both the kicking leg and the standing leg. The idea is we want to stay balanced on our standing leg while kicking the other leg out diagonally back. Why do we do this exercise? Because the knee oftentimes gets in trouble based on what happens above and below, right? So the knee is a pretty simple joint. All it wants to do is bend and straighten, bend and straighten. That's all it wants to do. If you look at athletes, if you look at knee injuries, just think about like basketball. A lot of times when you're planting, twisting, landing from a jump, it puts your knee in all these compromising positions. That's when bad things happen. So what we want to do is train this glute med muscle, which will help put your knee in a better position and keep your knees stronger. So as you're doing this kick out exercise, what the band is doing is the band is pulling your knee in, and you're actively resisting, even though you might not feel it. And I don't want your knee to fall inside and get pulled over. And if you're maintaining a good balance, if your hips are level when you're doing this and stable, you're not doing anything too wobbly, you're doing it right. So I'll also recommend doing this for 3 sets of 10 to 15 on each side. Again, if you have trouble balancing, you can kind of hold on to something, hold on to the wall while you do this. And that will just help take away the balance component of it. If it's too hard for you, you could lower the tension, so use a lighter band, or you could just decrease the rep range. Instead of doing 10 to 15, you could do 6 to 10. So that's it. Those are the 3 exercises. We talked about the reason why we do them and how to do them. But I do want to add that these 3 exercises are pretty low level to start. They're a great starting point. But if you do want to get stronger and prevent it from happening again and really build up your muscles, you want to build upon this foundation. But in order to think about long term, you really want to scale this up and continue to build on this foundation. So basically we want to make these exercises harder, but that's another topic for another day. All right, so give these 3 exercises a try, see if it helps you. Stay healthy and take care.